So tell me a little bit about what that experience was like, because it's not easy to go through the many years of training to become a doctoral level healthcare professional, and also why you decided to specialize in OCD of all things.
Yes, great question. So I happen to have gone to an awesomely supportive and even fun clinical psych program.
That is a rarity.
Um,
So
I know, like everyone was just so real,
yeah,
and it was just the professors were all supportive, and it was intellectually stimulating. It was just such a really great experience. I mean, it was definitely difficult, the coursework and the research, your master's thesis and your dissertation.
hmm
So it was jumping through a ton of hoops,
hmm
and you get really good at applying for things,
yeah,
right? Like you're applying for externship, and then you're applying for the next externship and internship. I probably wore down like that binder that you bring on every interview.
that's right.
Like it's probably to a nub. Uh, but there's just a ton of hoops to jump through, and to have a supportive environment like
hmm
that I had in grad school was like really indispensable
hmm
and really made all the difference. And there was also like a lot of different options in terms like allowed you to go into the clinical direction that you're interested in.
Yeah.
So there was a acceptance and commitment therapy lab, there
Mm-hmm.
was a dialectical behavior therapy lab, um, there was a parent-child interaction therapy lab. So you had so many choices of the population
hmm
that you wanted to work with and the therapeutic modality that you wanted to work with.
hmm
And so for my second externship, I was at a OCD specialty practice in New York City called the Reed Center.
Okay.
And I think, what I fell in love with is how conducive the condition is to the treatment that we do,
Mm.
right? So exposure therapy, like of all the treatments that I've done, whether it's dialectical behavior therapy or working or whichever diagnoses that I've worked with, like depression
hmm
or bipolar disorder, OCD and anxiety disorders are so well targeted by behavioral therapy.
hmm
And I know that I have a deep desire to be an effective person
Sure.
and to see change in front of me,
Right.
right? And it's probably selfish in a way because like I really want to see that change. Like
hmm
I do have patience uh, with the C, but I just love seeing those changes in front of you and people telling you like, wow, I didn't know that I could do this. For like 20 years I haven't you know gone outside to to a crowded area, and then I tried
Mm.
it and look, I could do it.
Wow.
So just like being able to give someone that on a regular basis is so rewarding, and I just fell in love with that.
Tremendously. Yeah. And, I think that also helps dispel one of the other notions that people have about therapy. There's this classical stereotype that, people just kind of go to therapy forever. Clinicians try to keep people in therapy forever. And I'm like, it's actually nothing further from the truth, especially if you're kind of more of a behavioral therapist. Um, the conditions like OCD and other anxiety disorders are the closest things to being curable, I would argue, in the spectrum of psychological conditions. And often, yeah, 8, 12 weeks, 16 weeks, you can see not only remarkable improvements, but yeah, like night and day differences in functioning. And it is tremendously rewarding. So it makes tons of sense why you decided to, pursue that path and kind of specialize.